Obsessive-compulsive disorder is a neurobiological condition that affects millions of people around the world. Hi, and welcome to the first episode of our series, the OCD Roadmap. Symptoms can come and go, or stay constant over time. Some people experience OCD in episodes, while for others, it's a chronic condition. The core features of OCD are the presence of obsessions and/or compulsions. Although technically a person may have one without the other, they're most often seen together. OCD is also known as the doubting disease. That's because people with OCD struggle to tolerate uncertainty. They often doubt their own memory, attention, or perception. So what exactly are obsessions? These are repetitive and persistent thoughts, images, or urges. They're not enjoyable. In fact, they're experienced as intrusive and distressing. In response, many people try to suppress these obsessions or neutralize them with another thought or action. That leads us to compulsions, repetitive behaviors or mental acts performed to reduce the anxiety caused by obsessions. They're not done for pleasure, but for a temporary relief. But that temporary relief reinforces the pattern, keeping the cycle going until the person is able to break it. Let's take a look at the numbers behind OCD. Who has OCD? When does it usually begin? Roughly 1 in 40 adults in the US will have OCD at some point in life. That's about 8.2 million people, nearly the population of New York City. The average age of onset is 19, but 25% of cases begin by age 14. The onset is often gradual, though in some cases it can be sudden. And if untreated, OCD can become chronic with symptoms that wax and wane over time. In adults, remission rates may be as low as 20%, but with proper treatment, especially CBT, outcomes improve significantly. 38% are in remission after treatment and 52% remain in remission at follow-up. OCD is slightly more common in women, while men often experience earlier onset. While OCD can begin at any time, there are two peak age ranges for first symptoms, between ages 7 and 12, and between the late teens and early adulthood around age 20. Behind every number, there is a person and a way to better care. See you in our next episode.